What's wrong with cognitive behavioral therapy?
It's not what's wrong with it. It's that its use is limited, meaning it was originally designed to help people with things like PTSD or OCD, or if they had habits that they were trying to stop. It's a very symptom-oriented relief. And by the way, psychoanalysts do use cognitive behavioral therapy in small doses when necessary, at least, again, good ones. I do, meaning I can work with a patient where I can also uncover what's happened to them in the past. But if they need some symptom relief, can also do some mindfulness training or some breathing. CBT therapists don't have the equipment or the training to go farther back in the past and help patients understand what is underneath those issues. So it's not what's wrong with it. It has a limited use, but the problem is it's being applied widely. So the best way I can describe the difference between depression and anxiety is that depression is a preoccupation with past losses. Anxiety is preoccupation with future losses that haven't occurred and may never occur. What they have in common is loss. So if you're treating a patient who has anxiety, there's always loss involved, and losses relate to the past. And so if you're not dealing with the past at all, then you're not really getting under the problem. And so you might have some quick symptom relief, some immediate gratification, but it's not sustainable. And a lot of the research is showing that people that go for CBT therapy, a lot of them get immediate relief, but it's not sustainable. It basically believes that you can heal people's anxiety and depression by just getting them to think about it differently. It's using your cognitive skills to think your way out of what are emotional issues. And so what I always say is, you can't think away something that is an emotional issue. You have to examine it on an emotional level.
So we had a cognitive behavioral therapist, Dr. Ortiz, on the show, and he talked about how, a big part of it is the experiential part, which is, let's say I'm afraid, I think an example he used was, I'm afraid of being in elevators.
Phobias.
So,
it's very good for phobias.
Yes, it's like, okay, here's what we're going to do. We're going to go
deconditioning.
Yeah.
It's very good for phobias.
And does it have more sticking power for that?
So think about the fact that if you break your leg skiing, you've had the experience of breaking your leg. And so when you go to ski again, you're scared that you're going to break your leg again. And you can develop a phobia around, breaking your leg skiing. And so what it does, it deconditions you. And that's why it's good for things like phobias, OCD, PTSD. What it's not so good at is if the thing that you're frightened of has nothing to do with an experience you've had. Meaning, I'm scared of elevators, but I've never had an incident in an elevator. That means it's not about the elevator. That means something is getting projected from the past. That's a loss that has nothing to do with the elevator, but it's getting projected onto the elevator. So if you get the person to not be afraid of elevators, you might as well just, it's a little bit like what I call plowing snow in the winter. You push it from one place to another. And so now you don't have a fear of the elevator, but you may have a fear of something else.
And so psychotherapy and psychoanalytics, I think, Sigmund Freud is probably the most famous name in psychology, right? To what extent is that work an extension of him? Where has it evolved past what he developed?
Truth in advertising. I was trained as a Freudian, but I'm not a strict Freudian. So I have many influences. I have influences from Jungian and from Kleinian. In my family, there are 3 analysts. I'm a Freudian. I have a sister who's a Kleinian and a brother-in-law who's a Jungian. So we are all together. It's a very interesting dinner conversation.
So your conversations about your parents must be completely crazy.
Yeah, never a truer word was said. Freud was living in a time that there was a lot of sexual repression. And so people want to judge Freud in these modern times when they can't really judge him because he lived in a different time. And in that time, people were very sexually repressed. And as a result, they developed what we call hysterical symptoms. Lots of hysterical symptoms. Hysterical blindness. Women would lose their bodily functions. And he was dealing with repression on a very deep level that would cause somatic physical symptoms, right? Today, we've moved away from that level of sexual repression. So in his time, he was brilliant because in his time, he did cure a lot of those people. That electric shock therapy and drowning them in ice baths, almost, the sleep therapy, there were many crazy therapies that neurologists and psychiatrists were trying in those days, right? But he actually cured people because he realized he made the connection between sexual repression and hysterical symptoms. What we now are dealing with, because we don't deal with that level of sexual repression, is we're dealing with a whole set of different issues. You could say it's evolved into what we call narcissistic disorders on a mass level. And narcissistic disorders include depression, anxiety, addictions of all kinds, eating disorders, alcoholism, drug addiction, all kinds of addictions, narcissistic personality disorders. So it's really evolved into something different. So we're in a different time, in a different place in terms of the kinds of symptoms and illnesses that we're seeing.
If you like this clip, we've got more where that came from. Be sure to watch the full video, and don't forget to subscribe to the channel so you won't miss our new videos as they come out each week.